Okay, so therapists recommend drugs for psychiatrists or medical doctors to prescribe for them.
Mm-hmm.
Okay, so how do therapists talk to somebody and realize that they need to take brain-altering drugs just by talking to them?
Right.
This doesn't make any sense.
Okay.
Because if you said, hey, we looked at a brain scan or,
Sure.
blood stuff,
Right.
and said, hey, you're not getting enough whatevers to your head, that makes sense.
Okay.
But talking to them doesn't make sense.
Okay.
So how do they do this, and what do you think about it?
Yeah. So, no, but they're not going to, hopefully, they're not like giving medicine like out the gate. Right?
Okay.
So, like, hopefully session 1 doesn't lead to medicine being prescribed. For me, personally.
But most of the time it does.
There may be other therapists that would disagree with me on that. But I think that it's going to take some time to understand where the person is to discover, do they actually need medicine to help them with their anxiety, with their sleep disorder, with depression, with panic attacks, ADHD, whatever it may be.
Mm-hmm.
And so I think that it's going to take time in discussing. But yes, I do think that over time, you can determine if this is something that is, take time to discover if this is something that is actually needed. And I mean, there are such things as like chemical imbalances that people
that makes sense.
Yeah, that
you need
genuinely
the chemical
deal with,
because
right?
You don't have the chemical,
right?
Or you got too much of the chemical, so
right. And then there's other individuals that need the medicine. Again, I use the word anxiety a lot, or the example of anxiety, because I'm intimately acquainted with it through people that I have counseled and through friends and family, and so I know probably more about that specific topic. And I think that, for example, if you're dealing with anxiety,
I feel like that is the lowest level of mental disorders that people get prescribed stuff for, and it seems like BS.
Well, and I think sometimes it can be, but I do think there's other times where they're genuinely in need of medication to help pull them off that edge, because in their anxiety, they feel like they're on the verge of a panic attack all the time.
Okay.
And I do think that getting medicine to help pull them off that ledge a little bit, pull them off that, get them off the edge and let them begin to be able to breathe and then actually go through therapy without feeling like they're on edge all the time, like they're like feeling like they're going through having a panic attack. Go through the therapy, receive the healing they need, and then you can begin to wean them off, anxiety medication. But for the individuals that are just prescribing drugs just all over the place and labeling individuals with all these different disorders and mental health issues, and I do think that's problematic when they're just handing out or prescribing medicine like it's like giving it out like it's candy.
Right.
So I do think there's a balance on all of it, but I do think there's a place for it that you can come to determine through enough conversations with that individual.